Why don't you just stop? Sound familiar? At ARCA, we understand the stress and anxiety of seeking treatment for alcohol or drug dependence. You want to quit, but you can't. No one understands that you need the substance just to feel normal. The most common question that we are asked is, how is the ARCA program different from others? And will this episode of care work for me? The Assisted Recovery Centers of America has grounded its programs in the latest evidence-based research, which indicates that the most effective way to treat the disease is through the combination of non-addictive, anti-craving medications coupled with psychiatric and psychological care on an outpatient basis where three things take place. 1, if confidentiality is important to you or your family, it's maintained. Number 2, it truly is a loved one and family disease. Oftentimes we hear that the disease affects the loved ones in your life or the patient's life, sometimes in more ways than it affects them. And third, you need to get well in your natural and home environment, where you learn to deal with the temptations, the issues, the stressors, the emotions, the times, the thoughts that first led to the problem and continue to fuel it. Never have I had someone come in and say, my goal 10 years ago was to be watching this video. We understand that the disease is very much about emotional health in your story. The ARCA program is centered on 4 key concepts. 1, medical detox to ensure that the process is safe and comfortable. 2, the onboarding of anti-craving medications. The anti-craving medications will help alleviate and block the biological urge, craving, desire that you have undoubtedly experienced during your struggle. 3rd, the treatment of the co-occurring and dual diagnosis symptoms. Most patients who struggle with an addictive disorder also struggle with things such as anxiety, depression, not sleeping well at night. Sometimes those symptoms can be more severe. These co-occurring disorders are oftentimes concrete driving forces for patients to use. When I can't sleep, if I drink, I'll be able to go to bed. If my depression is terrible today and I use, it'll go away for a few hours. As part of the ARCA program, it is our belief that both symptoms, the addictive disorder and the co-occurring disorder, must be treated in conjunction. And finally, the most important component of the recovery process, which is the therapeutic component. As we begin to bring your story to life in your natural and home environment, we will begin to deal with the emotions and struggles in a manner that allows you to make the proper change. Please take a moment to learn more about our programs by browsing our website. When you are ready, pick up the phone and call us at 314-645-6840 to schedule a free, confidential consultation. Congratulations on taking the first step. We are here for you.